Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department. Today is March 26, 2021, doing our weekly COVID-19 update for the town of Falmouth. Falmouth's website for everything COVID is falmouthma.gov. The email for the health department is health@falmouthma.gov. Non-COVID, non-vaccine related information generally, 508-495-7485. County COVID hotline is 774-330-3001, also not for registering for a vaccine, and we'll talk about that in a sec. So where are we with the phases? So right now, eligible this week are individuals 60 and plus and workers in certain sectors such as food, transit, agriculture, sanitation, public works, and public health. Eligible on the 5th of April, which is not too far away, would be individuals age 55 and older, and individuals at any age over 16 with one certain medical condition. And then on the 19th of April, it'll be open to everybody over the age of 16. So you have an increase in eligibility between 60 and 65, and a lot of people that work in those different sectors, which are outlined. This is right from the state website of what type of workers they are. Obviously, if you have any questions, you can call us at the health department, but restaurant, grocery, meatpacking, agriculture, consumer goods, retail, food service workers, vaccine development workers, we don't have any there, I don't think. Public works, water, wastewater, sanitation, public health workers, court system workers, other than those that have already been, well, some of them, such as court officers, were already under phase one. So you're eligible, and so you can get your vaccine. So how do you get a vaccine? So you can still pre-register at any of the state sites. You go on the right here, if you look at the right, this is what the screen will look like about getting registered only for the MassVax site, so that would be Gillette and Dartmouth would be the closest. You can also use the MassVax Finder, that information below, that's what the website would look like. To look at availability, that would be anywhere from MassVax sites to the Barnstable County to pharmacies and so forth. You also have massimmunizations.org, which is what the link will be when Barnstable County opens up clinics. It'll take you to Mass Immunizations for registration. So nothing's really changed on that end. One thing I just heard before I did this, right was into the PowerPoint, that actually your cell phones are going to start having a system, contact tracing system. So that app, if I believe you have Apple phones, you can already, it's already been downloaded, and you can activate it, and that'll notify you if you've had a close contact. So I think something's going to be coming out today on that. I didn't put a slide up because it just happened. I just got just was on a conference call before this, so I'll put that in next week's as well. And you'll probably hear about it on the news. Cape Cod Regional Vaccine Consortium. Cape Cod Healthcare continues to vaccinate at 4 Cs for the region's most vulnerable residents and seniors over age now 60. These are for people who can't register themselves. There's no online registration. You just call the senior center to qualify, and then we'll provide your information to Cape Cod Healthcare. It's been really, really effective in getting vaccines done for this population. We're also doing the homebound using the Community Health Center of Cape Cod. They're getting a list from the senior center. Again, if you're in either of these categories, please call the senior center to qualify. And we submit these lists to both the Community Health Center of Cape Cod and to Cape Cod Healthcare on a routine basis. And so if you fall into this category, please do it. It is the quickest way to get you a vaccine. If you can register yourself online, we would prefer you to do this. This is more for people, this worked really well for those over 75, where computer skills may not be quite the same. So it's really worked like a charm. Also, the Cape Cod Regional Vaccine Consortium, if you're having trouble getting a second dose appointment, you can either call the health department or the senior center. We'll provide your information to the consortium. So if you've had trouble getting a second dose appointment, either Cape Cod Healthcare's called you up and you've had the Moderna vaccine, or you've had one through the county, even if you're having trouble getting a second dose through a pharmacy, and you just can't get a second dose appointment, call either the health department or the senior center, and we'll be able to give your information to the consortium, which the consortium is Cape Cod Healthcare, Barnstable County, and the towns. So we have a clearinghouse for that, and then we would take your information and get back to you. The consortium is also seeking eligible food workers. As I said before, some of the eligibility by profession has been increased. So an email I had sent out yesterday to all food permit holders. We'll keep going from there for them to send to their staff to be placed on a list for vaccination. It's not an appointment for a vaccination. It's just a list of who's seeking a vaccination. Doesn't get you an appointment right now, but then what we would do is do similar to what we did with Cape Cod Healthcare in the senior population. We could work through that list, but still, I would not put my name on the list and just sort of wait for a phone call. So you should still be actively seeking vaccine, but this list would just help you, okay? If you haven't received this email, you are a food worker at this point, call the health department, and we can send you that link, but your employer, each email that we have on our food permits, we issue food permits to all food vendors, food operators. We sent that email out with all this information to them, so you can reach out to the the business that you work at, and for whatever reason, if that doesn't work out, then you can also contact us at the health department. So that's another avenue. Again, it doesn't get you an appointment, but it does get you on a list that goes to the consortium, and they work off that list. So we'll see how that one goes. And you definitely want to get a hold of us if you're getting close in your second dose, for your second dose, and you don't have an appointment for it. So that's a couple of new things from last week. As far as vaccine supply, I had mentioned last week that we have a 3-fold increase in doses being sent directly to the county. So in addition to the 2,000 that Cape Cod Healthcare is getting, you have now 3,510 a week of generally Pfizer, usually, going to the county. So next week, there's going to be 3 clinics, 2 at the 4 Cs and 1 at the fairgrounds. There'll be Pfizer. Doses are going to be rotated through the sites. You're going to see mainly at the 4 Cs, and you'll see the fairgrounds. I believe the next week and the week after will be the fairgrounds. The fairgrounds was due for some more clinics, and we'll have some more clinics there. Again, as the supply increases, we'll increase the number of clinics. It's quite simple. If we were getting 10,000 a week, we would get rid of 10,000 a week. We'd have 1 or 2 at the county fairgrounds. We would have Boston County Fairgrounds. We'd have several at 4 Cs. We'd be using the other sites in Orleans and the Lower Cape. So, again, more vaccine shows up, more clinics we'll have. And again, pharmacies have been sneaky good about getting vaccines done, even though you might not see that they're doing a lot. Every day they're plugging away at whatever number they're getting, and so that your other opportunities could be, I've had a lot of people have success going to the CVS in East Falmouth or the Walgreens in Mashpee, and there's others, down Cape and a little off Cape as well. If you're a veteran, you can still call the VA, which would get you an appointment in Brockton. If you're over 55, Mass Veterans also does vaccinations. So where are we with vaccinations? Cumulative percent of individuals with at least 1 dose has gone up 4% to 39%, so 39% of the population on Cape Cod has received at least 1 dose. Percentage of individuals who are fully vaccinated has gone up to 23%, so almost 1/4, which is up 5% from the previous week. So this is, you can see this on the state on Thursday. After 5, you'll see this information posted. And this is as of March 23rd. As far as Falmouth, this is also in the weekly. I just pulled out all the data that they give by town. Over 75, we've increased 1% to 88%. We're getting close to saturation of that age group, so either some don't want it, or it's just so hard to reach certain people. They haven't been calling the senior center or searching for one for whatever reason. We're at 88%. We've gone up 5% to 68 of second doses, fully vaccinated. That number should obviously continue to go up because a lot of people over 75 were done relatively recently. Even more so for 65 to 75, so that's why you see an 11% increase to 29% fully vaccinated, because you've had a few weeks to be the first dose done, which we've had 3/4 done, up 6%, and then you have the 11% increase to the second dose. We're getting increases in this 50 to 64. We're up 6% in the first dose to 27%, 18%, a 4% increase for fully vaccinated. And then under 50, we've been obviously less gains because it's unless you're in certain sectors, the eligibility is a little bit limited at this point. But as we open it up, then you'll see those numbers increase. So things are working as taking care of the seniors first and working our way down. The system's working. Net gain for first doses was 4% of the population increase, so we're at 40% in Falmouth with at least 1 dose. So that's where we're at, and we'll update that every week. We also post this to the website, so you don't need to memorize it. If you want to go back to it, we generally put it on the falmouthma.gov website. So that was it for vaccinations, and we're working on it. We're getting there. So let's talk about cases. We do need to talk something about cases. I find important, especially for the next couple of weeks. We're at 1,287 cases. I stopped this Thursday afternoon. since the beginning of the outbreak. That's 29 probable cases since the beginning of the month. There have been 33 confirmed cases over this past week, so Friday, late Thursday to Thursday at 4, so it's roughly when I break it off, so that's it. 97% or so of cases are out of isolation. We account for 11.1% of all cases in Barnstable County with 14% of the population, so that shows in general we have a lower rate of infection in Falmouth than a lot of our neighbors here on the Cape. Of course, the VNA, the CTC, and the Health Department, we're on Maven doing the contact tracing like we have now for over a year. And we continue to do that to the best of our ability. So you can see the case counts. If you come way back to the far right, you can see that we've had about 7 weeks of roughly 25 to 35 cases per week, but you can see that the last 2 weeks, you can see it being a little bit higher. The red dot indicates what's happened since yesterday afternoon. So we've had 10 cases since yesterday afternoon. So that tells me the trend is working upwards. And I'll explain why in a second. You can see the chart here is flattened. You know, we were starting to flatten out this curve. I'm a little concerned about what's going to happen over the next couple weeks. Again, just sticking with the facts for right now, the red, yellow, and green, we remain yellow. We're actually lower at 2.02% positivity. And our incidence rate was as low as it's been in a while at 10.5 per 100,000. Compare that to Barnstable County, they're at 31.1 per 100,000, and a positivity rate of 6%. So we're about 3 times lower than the infection rate right now in Barnstable County. I really wanted to show you this. We have to watch out for the ripple effect. So the town of Barnstable has had the highest infection rate, I believe, in the state this week. Yarmouth has had a high infection rate. You can see where Falmouth, I've circled it, is lower. That just means, and if you look at the colors onto the right-hand side, the darker the color, the more cases, the higher incidence rate. You can see Barnstable and sort of rippled to Sandwich, Mashpee, Dennis, and working its way to Harwich and so forth, definitely Yarmouth. That's going to work its way to some extent here over the next week or two. It's just going to do that. It's not, you know, there's no, virus doesn't recognize town borders. So it's really important that you're back to sort of thinking, you know, when we were in the spike over the January, February, and it seems like we've gotten better. I told back in January to start doing things that you did in March of 2020, all the social distancing and all the stuff, the diligence that you guys had. You're probably going to need to get back there at least one more time, being really strict, because I think there's going to be quite an increase in cases. Hopefully not, but there's definitely going to be a ripple effect from the high infection rate right now in the Barnstable-Yarmouth area. It's just going to, I find it hard to think that we're not going to have a net increase. You can start to see it already in the chart I showed you previously. So just want to let everybody know that. So if you've got plans, if you're going to go, you know, if you're going to travel into Barnstable, Dennis area, things that you're going to be doing, start to think about the rate being going to be increased over the next few weeks. I just want everybody to know that and to take their precautions. You can see it also in the data. Here's all Barnstable County cases. You can see we went up, and then we came down in that sort of February, early March, but you can see it peaking back up. You know, we found a new variant a couple weeks ago. It was in the paper that could attribute to it. So we just want to make sure you're taking extra precautions because the cases are coming up. I hope they don't come up to where they were in January, but there's a possibility. So let's, you know, just want to make sure you know that. Hospitalizations, you can see it in the hospitalizations. You can see, well, Falmouth Hospital is still in that 2-3 range. But if you look at Cape Cod Hospital, it was in the 10 to 12 range, and then it doubled in a week, roughly from the 18th to the 23rd, from 12 to 23. So there's an increase in cases, there's going to be an increase in hospitalizations, and unfortunately, eventually an increase in deaths. But, you know, hopefully because we've vaccinated our older population, that the death rate and the severe hospitalizations don't follow what's happening with the cases. Most of the cases have been younger kids, middle-aged people that haven't been vaccinated yet. The state data shows that we're doing fairly well. Here's it right here. If you see the curve, you know, it was almost the reverse last year, you know, in the spring. You can see that the 0 to 19, the 20 to 29, the 39, and the 40 to 49, and the 50 to 59 are much bulkier cases. The group that you've done, sort of the 60s into 70s into 80s, you can see it much lower. So it tells you that the vaccine does work. And so, As we vaccinate, those numbers should go down. We just need to get through this blip, this increase that we've had over the last week or so, or going to get. Cases in the state are up. We were in that 12 to 1,500. Now we're at 2,200. So, some of that would be, what's happening mid-Cape. We're averaging about 100,000 tests in 2000. So our positivity has gone from about 1.67, we were around at our lowest, back up to 2.2. So we're in the wrong direction for this. Part of it's probably got to do with the variants. People relaxing, things of that nature. So, we just got to get back into it. 631 patients in the hospital, 87 patients intubated, 137 patients in intensive care. So my guess is that hospitalizations won't necessarily mimic the cases because of vaccinations. But our positivity in cases would increase, which would hopefully see the hospitalizations don't increase at the same rate, for that reason. COVID testing hasn't changed. You still go through Falmouth Hospital, through your physician if you want. You can also go to the walk-in like Convenient MD, the Community Health Center of Cape Cod, East Falmouth CVS. You can also go through the drive-through free at the fairgrounds. You call the fairgrounds to book an appointment at 508-563-3200. Okay, between 8 and 2 they do it, and it's testing on Tuesdays and Fridays. They open up the fairgrounds. It's the same place we do the vaccinations in the barn. So you can have a free one on Tuesdays and Fridays, or go to the other places that you would normally have gotten a test. Gatherings haven't changed much since this week. We are in the phase 4, step 1. Stadiums and arenas and so forth have a capacity now of 12%. This doesn't include fairs, festivals, road races, and other events at this time. Again, it's going to depend on where we are with cases and vaccinations when we start talking about things like the road race and fireworks and stuff like that, and fairs and festivals that we are known for here in Falmouth. As far as gatherings, private settings is 10 indoors, 25 outdoors. Event venues and public settings that don't fall into the stadium would be 100 and 150, so 100 indoor, 150 outdoor. So we're at that, it is effective. It did go into place this past Monday. So, and that's where we are with that. Travel advisory now, I did mention this last week, but visitors are being advised to quarantine entering Massachusetts. Travelers should get a test 72 hours prior to their arrival in Mass. If not obtained before entry into Mass, a test may be obtained after arrival as long as the traveler is quarantined. Now we're asking that, still asking for that. It's not an order, it's now an advisory. It's exempt anybody who's going to spend less than 24 hours, out of Massachusetts. And travelers who are fully vaccinated do not need to apply as well. So that's the travel advisory. You really do want to limit a little bit of travel. I think that's probably one of the reasons. We do have Easter coming up, school vacations coming up. If we have a high rate of cases, then that just causes it to, increase the frequency of cases. So we're just going to have to take that into consideration. So again, staying home when ill, self-isolating, getting tested, continued diligence with social distancing. The face coverings is not going away anytime soon. Hand washing, hand sanitizing. The travel thing is big. Quarantining upon it. I still advise you to follow the guidance, the advisory for that. The gatherings, the parties, indoors, and so forth. So again, you're going to have a lot of cases not far from you that are going to eventually work its way to some number that's going to be higher than we have now. And you just need to keep that in mind with what you're doing as far as gatherings, parties, and so forth. So be safe out there. Next, so as far as our recap, I updated the vaccine eligibility now. So 60 and over. Falmouth resident vaccine rates, so we're pretty similar to other Cape Towns. So we're all doing fairly well. As clunky as the system's been, people are finding vaccines. You get into the mass vac sites, or you're finding Cape Cod Healthcare is finding you, or you're getting onto the Barnstable County clinics. State metrics are showing an uptick. Falmouth remains yellow, is in that 25 to 35 for the last 6 or 7 weeks, but we are trending a little bit upward. So watching the big mid-Cape increase, it's a very large increase. Community spreads occurring and mostly likely will increase, just seeing what, the ripple effect of having cases, an increase where we had so close to us. Regionally, vaccines being administered as arrives, the supply is getting better. We're up threefold. So between Barnstable County Health and Cape Cod Healthcare, there's not counting the pharmacies, you're up around over 5,000 per week. Then you add in the community health centers getting it. They're helping us at the community health center here with homebound, people that are having difficulty getting out. And then the pharmacies, again, do a bang-up job, and they get directly from the feds their vaccine. So we don't necessarily get a report on exactly what they're doing. But they're definitely making a dent because we are where we are, and we're getting there. So that's the recap for the week. Again, cases. Don't be surprised if cases are up quite a bit in the next week or two, just because we're seeing it in other towns. Just keep plugging away to get your vaccine, and that'll be it for this week, and we'll see you guys next week. Thanks.